why food allergy awareness is important? Because 20 to 30% of Indian population is suffering from one of the allergic diseases. It can be cough and cold, which is allergic rhinitis, can be asthma, sometimes it's food allergy, sometimes there are skin allergies. So allergy incidence and prevalence in last 4 decades are rising from 10% to 30%, and around 8 to 10% of them are suffering from food allergy in recent studies is showing. So food allergy, if we don't treat, sometimes we may have severe life-threatening reaction. Initially you may be suffering from milder reaction and you think that nothing will happen, but sometimes on repeated exposure you may suffer from sudden breathing difficulty, choking, low blood pressure, and suddenly you may faint, and there may not be any time that you can go to hospital and get treated. That's why we should be aware if we are suffering from any adverse food reaction, whether it is food allergy. What are the common food allergens we say? So there are 5 food common allergens. One is egg, second is peanuts, third is wheat, then seafoods and soya bean. So these are very common food allergens which we talk on daily basis, and there are many other food allergens like simple any kind of pulses or dals which we eat. It can be certain fruits also. Sometimes certain vegetables can also create problems. Sometimes certain nuts can create problems. So if we have symptoms like vomiting, diarrhea, abdominal cramps, persistent bloating, chronic acid reflux which is not getting resolved, or sometimes on and off skin rashes in form of hives, which normally we say urticarias, or skin itching, or sometimes constant headache, and in children sometimes persistent cough and cold is also because of some kind of food allergies or milk allergies. Sometimes it can be eye irritation, skin itching, or ear itching, or redness in eyes. So there are various symptoms in the body which can happen because of food allergies, and mostly the allergic manifestations are why they are in various organs, because allergy is a systemic disease. So you can have skin symptoms, respiratory symptoms, gastrointestinal symptoms, or it may be affecting your heart and lung and causing severe anaphylactic symptoms. So why lot of systems are involved here? Because it affects our immune system. So immune system creates antibodies to particular food allergen. So now we are going to see that how we can diagnose food allergy. So first thing is, you give the symptoms that the moment I eat this particular food, I have certain symptoms which I described. That is one way. Second way, we do check certain physical examination when you come to us. We try to see whether you have any rashes, if you have redness in eyes, or whether you have some wheezing in chest, or if some kind of skin reactions, or sometimes if you have severe abdominal pain. So there are various signs also to suggest whether you have any kind of allergic reactions in the body. Then third thing comes is that we do a skin prick testing to particular food allergens. So we apply that particular food solution to the skin, and then after 20 minutes when we prick, there is a small bump reaction or some redness which tells us that this particular food you may be allergic or you may be sensitized. The fourth thing come here is that you can do certain blood test. So certain antibodies to particular food can be measured, specific IgE antibodies in the blood. So we take the blood sample, and in that blood sample we can assess which particular food allergen antibodies are positive, which gives us idea that you may be allergic to that food. But it's not that if it is positive always you are allergic. Sometimes it's just a sensitization. Then comes elimination diet, and when we challenge to particular food, you have the symptoms. So elimination diet, empirically 4-5 foods we eliminate from your diet, or particular food which you ask, which you tell me that okay, I'm allergic to this particular food probably. So for 1 or 2 weeks we eliminate that particular food, and then if you have complete response and if your symptoms are completely gone after eliminating that food, that means that food may be a allergic food for you. Okay, and when we re-challenge back that food to your diet, re-challenging means you start eating that food and again symptoms comes. That means probably this particular food is culprit in your case where you are allergic to this food. And sometimes we do oral food challenge test. That is mostly in the severe cases. We in the office clinic, office practice, we ask the patient to eat that particular food in front of us. We start with very small amount and slowly we increase the dose. If you don't develop any symptom, then we allow you to have that food. And normally we do this when we have to reintroduce this particular food after treating food allergy. So these are the common methods how we can diagnose food allergy.